Hello everyone, welcome to this lecture. Studies identifying genetic and environmental factors. First one is twin studies. Monozygotic twins we have and dizygotic twins. Monozygotic twins shares 100% genetic material and shares same environment. Dizygotic twins shares only 50% genetic material and shares same environment. The word concordance means both of them having the disease or both of them not having the disease. Discordance means either one of them has the disease. Monozygotic twins. If disease is primarily of genetic origin, high chance of concordance because they share 100% genetic material. If this is primarily of environmental origin, same concordance rate also be there. Exception in case of monochorionic twins. Their discordance rate is seen. Why? Because they share the same blood vessels. For example, in case of thalidomide use in mom can cause limb defect in one child. Dizygotic twins, if disease is primarily of genetic, low chance of concordance because they only share 50% of genetic material. If this is primarily of environmental origin, the same concordance rate will be there. The 2 by 2 table for the twin to calculate the concordance rate. Twin 1 upper side we have twin 2. Twin 1 this is positive, this is negative. Twin 2 this is positive and this is negative. So first one A cell both has the disease, B cell twin 2 has the disease, C cell twin 1 has the disease, cell D both doesn't have the disease. Concordance rate is equal to this A divided by those who have the disease. Discordance rate is B plus C divided by A plus B plus C. Monozygotic twins concordance is more than dizygotic twin concordance means disease is of genetic origin. Monozygotic concordance equal to dizygotic means disease is of origin. Now the scatter diagram, monozygotic twins clustered. For dizygotic twins, it is scattered. So that means disease is most of genetic origin. In monozygotic and dizygotic both clustering is seen. That means disease is of environmental origin. So next one is adoption studies. Biological parents shares gene. Adoptive parents shares same environment. Now if the disease resembles the biological parent means disease is of genetic origin. For example, schizophrenia. If disease resembles adaptive parent means disease is of environmental origin. For example, hypertension. If disease is there in adopted child and biological child, it is of environmental origin. If disease is only there in adopted child, may be of genetic origin. If identical twins raised at different home, if both having the disease means genetic origin. If identical twins are raised together, both has the disease, again genetic origin. One has the disease, environmental origin. Migrant studies. Compare disease rate among migrants with country of origin. For example, Japanese after migration, cancer stomach was declining. Lung cancer, colon cancer and prostate cancer were increasing. Now age at migration also matters. Environmental during childhood related to the disease. Example in multiple sclerosis, if children less than 15 years migrated, their risk is similar to the host country. If age more than 15 years migrated, their risk is same of migrated country. Now linkage analysis. Gene is the functional DNA segment. We have DNA markers. It is non-functional identifiable DNA segment. This is used to track the nearby genes. For example, we have DNA markers, microsatellites, RFLP bands, SNPs. So linkage analysis check the disease is inherited together with the specific DNA marker. This helps to identify the affected gene's location. For example, if microsatellite marker is high in that particular patient, some genes nearby the microsatellite has the problem. That is how we'll be tracking the gene's location. Now study population is family, best for rare disease or single gene disorder. and identify genetic risk within the families, identify carriers, understand the hereditary pattern, map the disease gene, guide for genetic counseling. Association studies find statistical association between genetic marker and the disease. Count marker frequency in each case and controls. So tooth by table, marker here, marker absent. Cases and controls. A, B, C, D. Now we'll be measuring the odds ratio. If odds ratio is more than 1, marker is associated with increased disease risk. Suppose we are taking 100 patients. In 100 patients, around 70 patients are having that particular marker positive. 30 patients are not going to have the marker positive. This is for case, and for controls also we'll be taking values and we'll be putting the values in the 2 by 2 table. Odds ratio will be calculated and we'll get the association. Study population is unrelated individual. This is best suited for common diseases, multifactorial diseases like diabetes, hypertension, cardiac problem, psychiatric diseases. Identify disease associated variants and understand genetic contribution to common disease. Risk prediction at population level. We are at the end of our lecture. We have studied about studies related to genes and then environment, adoption studies, twin studies, migrant studies, linkage analysis, association studies. Hope you understood the lecture. Thank you for listening.